Contention 1. After having an abortion, teenagers are at risk of psychological injury so extreme it leads them to desire the alternative of suicide. Subpoint A. 40% of minors having an abortion didn't tell their parents. Abortion73.com, updated June 2013, access November 5th. In 2009, adolescents under 15 years obtained 0.05% of all abortions, but had the highest abortion ratio, 785 abortions for every 1,000 live births. 40% of minors having an abortion report that neither of their parents knew about the abortion. Subpoint B. Abortions raise risk for mental health problems. British Journal of Psychiatry, published 2011, last access October 30th. Women who have an abortion are at 81% increased risk for health problems, including anxiety disorders, depression, drug abuse, and suicidal behaviors. The study revealed the shocking statistic that close to 10% of all mental health problems in women can be directly attributed to abortion. Subpoint C. Teenagers are at a higher risk for psychological problems after an abortion. David Reardon, author of Aborted Women, published 1987, accessed October 25th. Women in their teen years are at even higher risk for developing psychological problems following an abortion. Half of the teenage abortion patients suffered a worsening of psychosocial functioning. 60% reported suicidal indication, with 28% actually attempting suicide or half attempted suicide 2 or more times. Subpoint D. Suicide rate after an abortion is 6 times greater. Ian Gentles, writer for the Human Life Review, published fall 2002, accessed October 30th. A recent large-scale Scandinavian study found that within 1 year of the end of a pregnancy, women who had induced abortion suffered a mortality rate that was almost 4 times greater than that of women who delivered their babies, and the rate of suicide was 6 times greater. A recent study in Wales found that women who had induced abortions were 2.25 times more likely to commit suicide than women admitted for normal delivery. A large-scale California study just recently published reported similar findings. Subpoint E. 6 to 10-fold increase in suicide attempts among adolescent girls who aborted. Ian Gentles, writer for the Human Life Review, published fall 2002, access October 30th. Teenagers who abort are at greater risk than older women for later psychological and physical problems. They suffer lower self-esteem, absence of affect, and greater symptoms of depression than those who either are not pregnant or carry their pregnancies to term. The most striking evidence of this is a major American study which found a 6 to 10-fold increase in suicide attempts among adolescent girls who had an abortion at any time in their lives. Contention 2. By installing our plan of parental consent, parents or parental figures provide the emotional strength and backing a teenager needs to handle the situation. Subpoint A. Parental consent laws reduce minor abortion rate by 19%. Michael New, writer for the Family Research Council, published 2008, accessed October 30th. Laws that require parental consent instead of parental notification reduce the minor abortion rate by 19%. The more protective a parental involvement law, the larger the decline in abortion. Subpoint B. Parents are the appropriate medical decision makers for their children. American Medical Association, published 1993, access October 28th. Parents have traditionally enjoyed a strong presumption under the common law that they are the appropriate medical decision makers for their children. While the state must intervene to protect against abuse, parental decisions are almost never overturned as long as parents choose from among professionally accepted treatment options. Subpoint C. Parents help their children through the tough challenges an abortion brings. Teens in Abortion, National Right to Life Educational Trust Fund, published May 2006, accessed October 28. Even if a decision is made to have an abortion, parents can help their children through the tough physical challenges and emotional issues that follow. At the clinic, parents can help teens through medical crises by being an important resource about family medical history, which can help determine if certain abortion methods pose special risk for the teen mother. Subpoint D. Greater experience, information, and post-procedure care will prevent adolescent deaths. Teresa S. Collette, professor of law at University of St. Thomas School of Law, Public Discourse, published March 29th, accessed October 24th. Parents who know their daughter has undergone abortion can more readily identify any post-procedure problems, such as infection or hemorrhaging, two of the most common post-abortion complications. If caught early, both infection and hemorrhaging can be dealt with easily, but if ignored, either can lead to other complications or even death. I now stand open for cross-examination.
So, you're saying that parental consent laws will reduce the number of abortions, right?
That could be an effect.
Yeah, that's what I'm saying. Okay, so is there any way that teenagers can still get an abortion after that?
After what?
Even if with the law implemented, can they still get an abortion
Yes, illegally, possibly.
illegally? Is that worse than if they go to the hospital, or?
Potentially, yes, of course.
So should we deny them the proper care at the hospital if they were to have an abortion, if nothing would stop them from getting an abortion?
The parental consent laws would only aid the teenagers.
Yeah, but if their parents don't allow them to have an abortion, but they want to have an abortion,
But if
since it's
if
their
the
decision.
well, if it's in the best decision for the teenagers to have the pregnancy, and that's what the parents want, then they should figure that out.
Okay. You mentioned in contention 1, sub point 8, that what was the percent rate of under 15
Under 15 was 0.05 of all abortions.
0.05 of all abortions. Do you have any idea how many abortions happen in pregnant?
No, I think.
No?
But that's just under 15 years old. That doesn't include all minors.
Okay. Do you know the age that most abortions, the age of the woman that that has most abortions?
No idea.
Okay.
All right,